Hey, we're live. Hello. How are you? Oh, I'd say how are you. That's such a general term. It's Friday. I hope you're in a Friday mentality. Even though I know I became disabled because of my stroke, it doesn't mean I don't carry my Friday mentality. I do. I still do. It doesn't leave my body, even though I used to work full time, as a lot of you do. And what I want to talk about today, and I want to jump right in, is why I'm standing up. I said, let's do the daily practice. And the daily practice today is called arm crosses. And you can do this sitting down. The idea is to open up your chest and use your chest and shoulder muscles and just give you room to breathe. Air, oxygen breathing naturally from us to our brain is so important. And that's why I started standing up. And you can do it sitting down. The idea is just get your shoulders back and bring your arm across your body. If you can, use the other hand and arm to hold it there for a few seconds. And then bring it back. And then we're going to do another one across the other side. Bring it across. Hold it there for a few seconds. And then bring it back. We're building up this pattern and these joints and muscles and movement and trying to keep that open, because getting air into your lungs, obviously into your brain, is going to benefit for aphasia and language and all the practices that we need to do in our recovery. I also do recognize there are other components of recovery that you may have to do, as I had to do for a cerebellum stroke. And I'm going to bring up a couple things about aphasia that in particular. So now we'll do into some education part. But aren't you glad you're here today and listening today? Because I started right out with the daily practice. Do that every day, even sitting. And the idea is to open this up and work on these joints and muscles to help the airway process and get our oxygen to our brain when we take some deep breaths. Maybe I will do that right now. I'm doing mine a little too fast. Should be 4 seconds in. And 4 seconds out. That's really what it should be, or what is best. But sometimes I do it a little fast because I want to get to my next topic. Oh, this morning I'm looking at aphasia is notably a speech disorder. And overcoming that requires a lot of work and a lot of mindset, but also a lot of tools. And I encourage you to work with your speech therapist or another medical team member regarding what you could be doing regarding tools and what you could be doing. I have a couple tools that I had used or still use. The one that I still use is called Abilex, and it's Abilex, and there's a picture of it. I went quickly because think of it like putting a spoon in your mouth, a plastic spoon, I should mention, a plastic spoon or a straw, and you have to move it around. And that's the Abilex is a tool that my speech therapist recommended, and we got that for my therapy. It's for dysarthria, as well as what's the other one? It's pronounced differently. Dysphagia, which is the swallowing, and it is for that. And I mentioned those two in particular because there was also another thing that we did in the office, and the tools and technology offering these innovative solutions. And the tools was in her office, and it was a neuromuscular electrical stimulation. It wasn't the over-the-counter neurotransmitter activity. Please work with the medical team to see if this NMES, neuromuscular electrical stimulation, if it's right for you. and asked them about the over-the-counter. I asked her about the over-the-counter, and she said it's not going to do anything for you, meaning we reached my maximum. I'd had to do this in the office. She did that for me. I mentioned it that way because it was COVID, and they only opened the therapy clinic for certain patients. I was one of them. I got to be going in. It was kind of good because I had hearing sensitivity, so it was never really crowded until, I don't know, about 9 months later. I was telling them I really can't come in anymore. The crowds were too much and it was too noisy. I always had to wear earplugs, which is low-tech technology, but earplugs are in my pocket when I'm out in public. I have to wear them at the grocery store. I have to wear them just a lot of times. I can't handle all the noises that are going on because my brain can't separate out what I'm listening to. That's an easy way of saying it, but certainly there's some medical technical terms regarding what's going on, but super hearing sensitive. I couldn't even use a cell phone for a long time. It was just much too much feedback or something was going on that I couldn't use it. We won't go down that path so much as I wanted to mention the about the NMES, neuromuscular electrical stimulator. It goes, electrodes go on your face and your neck, and it's really improving the muscle tone and range of motion and coordination. We would do one side of the face, then we do the other side of the face to certainly help with it leads to better speech and swallowing using my neck muscles too, and just overall facial control. And done in the office, she really said to me, there's only so much you can do. It's one of those processes in stroke recovery that you really kind of reach a maximum that you're not necessarily going to see further results. So the rest was up to me, and that was the Ablex at home. 3 times a day, 5 repetitions each time. I was pretty much exhausted after each time because working the facial muscles is part of what I was doing, but also working just the whole movement of the mouth and getting my brain to remember how to do that and how to work with words again. And that, as I smile and I speak with you, these are all repetitive activities. Not every day is as easy as the day before or tomorrow or vice versa. It's not the same for any of us, and I do recommend your medical team regarding that. Even the arm, please check with your medical team to see if it's okay. But I want to make sure you're not, when you do this, don't do this. Don't move your body. Just keep your shoulders and bring your arm across, which is why I didn't want to do it in front of you, because my hand goes right across the screen. But I wanted to stand up, and if you can stand up, please do. I'm happy that I can. I had to use a cane, and I couldn't have done that. Even now, sometimes some terrain, I definitely need a cane. But I'm looking at all of you going, wow, it's Friday, and I'm hoping and just wishing you a wonderful day. I'm so glad you joined today. Please try your daily practices, and I hope you got something out of it. Okay, take care. Bye.